in our younger days, we met out on Smith Avenue, and you know, I still have a bruised rib, I think, from Mr. Crockett back in those days. But we've come full circle and be working hand in hand trying to better the Park Heights community. It's good to be here in Park Heights. Really pleased to be part of Sinai and part of the Park Heights community. So I'm not going to keep everybody long tonight. I've got 4 things that I think are very exciting for the community and for Sinai that I'd like to talk about tonight. The first is the community health needs assessment. Actually, let me go through the 4 things I'm going to talk about. Is community health needs assessment. I'm also going to speak on our aging in place program. Third thing is Sinai, something that a lot of people don't know about, Sinai's Community Service Corps. And then fourth, something that some of you have been involved in the past, is Sinai's Community Small Grants Program. So first, the community health needs assessment. So every 3 years, in order for Sinai to maintain its nonprofit status, it needs to do an assessment of what the community health needs are. And it's good for Sinai, obviously, because it's a nonprofit and needs to maintain that status. It's good for the community because it's a time when the community says, hey, this is an important health need for us. And then Sinai can tailor what it offers in terms of health access to what's appropriate for the community. So for example, if let's say in the survey, asthma turned out to be really high on the, on the radar screen for residents, and we didn't address asthma in a robust way in the hospital, it'd be a mismatch. So this allows for the things that we provide in terms of health care for the community to be appropriate. As an example, 3 years ago when we did this, one of the things that came out was that there was an express need for an urgent care center, like patient first. Our partner is Express Care, and so that's going to be built at Green Spring and Silver, right? And that came out of the community health needs assessment 3 years ago. There's going to be 2 or 3 community, once we get all the surveys in, then we're going to have 2 or 3 community forums to discuss. It's easy to do a checklist, but then to discuss like the detail and the depth and what the interests are within that go beyond the survey. So, do we have any community presidents in this room? Okay, Mr. Crockett, Ms. Eaton, Mr. Brooks. I think I've given some of you at the board meeting, but I was going to ask if you could take these surveys back to your communities, get folks to fill them out, and then I see you guys almost every week, so I'd be happy to collect them at a convenient time. And Maxine asked me to bring tchotchkes, so I got these lovely LifeBridge cups. And they can do whatever you want. I would call this, like, if I was with my son, it would be a soup cup. If Maxine and I were listening to jazz, sipping an adult beverage, it would be another cup. So it's whatever you feel that is important to you. If you can't get 50, so anybody who turns in 50 gets a cup. If you can't get 50, you get a plastic tank. So it's, however enthusiastically you can energize yourself about this. It's important for the community and the hospital. I would ask that if you can, if you want to fill one out for yourself tonight, that would be extremely helpful, and I could turn them in tomorrow. Last year, 3 years ago, I'm going to try to double the number that we got. We got about 300 or 400. I'm trying to get close to 1,000 in terms of responses from the community. Any questions on community health survey? Yes, Will.
Is it possible to do that survey electronically?
It is not, and I'm embarrassed to not have an explanation as to why, because it is 2015. But I will blame it on being new to the system, is not understanding why it can't be done electronically. But I will say, I understand where you're coming from, And if we're all here 3 years from now, it will be done electronically. Yes, ma'am.
Two things. I think I answered the first one, and like maybe once we get the actual numbers on what comes back from the community, that it'll be about a 3-year gap between assessment and then implementation of what people have said and have come back with, or how soon will we see a turnaround?
That's a really good question. I think that's what the forums are all about. So rather than doing an anonymous survey, then you can come and say, hey, my family is really interested in this particular issue, and let me tell you why. And
We did it last time. And I know we wanted to get a good number of people participating in the survey. Because if we looked at 300, that's about 1% of the population. So if there's that's why I asked him to do it, like, if it can be done electronically, only because maybe you increase that number, get a large percentage of
Well,
people.
I can tell you that we're already we're almost in 3 days since we started this, we are at 200. So we're at a really good rate right now. And we haven't hit National Night Out, which I'm hoping folks, we've got 3 National Night Outs going on in Park Heights, which is fabulous. Don't sell Park Heights short. When you have one community having 3 National Night Outs, to me, that makes a very bold statement. And so, you know, I'm sure you have a lot of visitors, elected officials coming through once they know that there's 3 National Night Outs in the Park Heights area. So I'd ask you if you're organizing, I know, Will, you got a National Night Out going. I know that New Solid Rock has one in Arlington. I know that the Deltas has one in Southern Park Heights. We're hoping that at National Night Out, if folks will fill out the surveys, just collect them, put a clip on them, and hand them to me, that'd be fabulous. The other thing that would be very helpful is, I know that there's a lot of back-to-school events. And so if your neighborhood is conducting a back-to-school event, if you can ask mom or dad to fill out the survey to help us provide the need health access in the community, that would also be a good venue. So we're really counting on National Night Out,